Hi, this is Smita Kumar, and you're watching Medicircle. Today, in our Top CEO series, we are talking to Dr. Parveez Ubed, founder and CEO, ERC Eye Care. He's an ophthalmologist by profession. He started his working towards a mission to help people see better so they live better lives with an affordable omni-channel design for eye care delivery. Currently, he is working on tech-enabled delivery modules, exploring the use of AI and machine learning in an effort to democratize digital health eye care for the people in India and Southeast Asia. Hi, Dr. Parveez. Welcome to Medicircle.
Hi, hi Smita. Thanks for the nice introduction.
You're most welcome. So to begin with, Dr. Ubed, the three major challenges of the healthcare industry are affordability, availability, and accessibility. So what, according to you, is the solution to eradicate these issues?
It's uh, it's simply, it's simple to say it, but to eradicate these issues, many people have been working for such a long time, and now with the pandemic situation, the problem has compounded, particularly in terms of the accessibility issue. Because now so earlier we were dealing with people who were in semi-urban rural areas who could not get accessibility. Now you have people in the cities as well, because of their age and their risk profile, they are not allowed to come out of the house. So accessibility has assumed a different meaning in the current situation. Affordability was an issue in healthcare,
Yes.
and availability was always, because in a country like India with such a large population, availability, particularly in terms of resources for all the people, was difficult. Now, when we talk about solutions to that, so when we talk about affordability, I think we have to see from a perspective key how to do a volume-based treatment which is available for the people with better transparency. Yes, there will be premium treatments available, but I always give an example like if you want to go from, let's say, Delhi to Mumbai, you should have the option of going by bus, by train, by flight, or even a private jet. But at least everyone should be able to go. So when you talk about affordability, it should be transparent and some volume based, because once there is volume, you can always decrease the cost and give it to the people at affordable rates. Coming to the other 2 points, availability and accessibility. So in a resource restrained situation like India, tech is the only solution. What we see in India currently is that tech being used for premium care. You have platforms for doctor consultation where the fees is very high. Now, when I say democratize digital healthcare, we mean to say bring digital to Bharat, bring digital to those who actually need it, because their per rupee is more valuable than the person sitting in the city. So if we have to make them available and accessible, we somehow have to use technology with digital, with better user experiences, with vernacular and other things, so that it's possible for them to avail and access it.
So how has your journey been in the healthcare ecosystem?
So, it has been a journey of ups and downs like any entrepreneur, whether in the healthcare or any other system. So, I'm an ophthalmologist. After training, I worked for 4 years in different sectors in eye care. Then started ERC way back in 2013 as a pilot. So, a small company, kind of, two people. And what we did really well was to understand the patient pain points. Everything that ERC provides today, like its low cost, its locations, everything comes from understanding the patient uh, pain point, and we call it the IPCEC, or the Integrated Patient-Centric Eye Care. Even the digital. So we would ask me why AI, why machine learning, why so big words I'm trying to use. It also comes from the patient, because when we now realize that accessibility has become a major challenge, then how to solve it? And the only way, as I said in the previous answer, was technology, telemedicine, user experiences, vernacular. And we have evolved over a long time. Like we have hospitals, we do community with our mobile units, we have the digital platform as well now. So all this comes from one question: how to serve the patient better. And that's the IPCC that we have. Smita.
Yes. So we have seen a lot of changes in the way the healthcare industry works due to COVID, especially a lot of things have changed.
Right,
Digitalization has happened.
right,
A lot of things
right,
which we never imagined are actually taking place. So what according to you
right.
will be the future of healthcare?
So with COVID, and like business people say it's the black swan event, and it is, and it comes with major learnings. Whatever work will not work any longer. Because if it were to work, we would not be sitting in our homes for the last 9 months. It won't work. So we have to find some different solutions through proper design thinking and not rely on what we already knew. Fresh ideas has to come in, and I believe at a personal level, this is where technology will mean healthcare in the true sense of the term. Earlier, yes, health technology was there, but conventional mainstream technology was a little bit separate from healthcare. But now I think both has to meet to take things forward in the next step. Yeah, Smita.
So India's total healthcare spending is at 3.6% of the GDP, which is very less compared to the other developed countries like US spends across 18%, Japan around 10%. We are not spending that much. So do you think it's high time India needs a generous amount of spending in the healthcare sector?
Right, Smita. So basically, I mean, we are a country of, as I said, resource strains, and I can understand the government being confused on where to put money, where to prioritize. So many things to do, right? But I think I heard a news 2, 3 days back that this budget is going to be different in terms of increased spending in healthcare. And I'm really hopeful because now everybody's eyes is open that without people's health, the country can go into a lockdown for so many days.
Sure.
And you need to have that insurance that everybody, whenever they need, whether they are poor, middle class, rich, doesn't matter, whenever and wherever they need the healthcare, it has to be provided. And infrastructure, both in government, in public-private partnership, or even in the private sector, has to be there, and the government has to ensure that. And I think, therefore, it's very necessary to increase the spending, and I'm sure that the government will do that this time around.
Sure. So thank you so much, Dr. Ubed, for sharing your insightful views with Medicircle. I think it would be really helpful for our readers to understand healthcare in a more in a better way. And we wish you all the best for your ERC and your all your future endeavors.
Thanks, Vita, and thanks for the opportunity to be able to connect with so many millions of people through your platform. I'm really glad and grateful for it. Thank you.
Thank you.